ASMR. Hi, how are you today? I'm your new doctor, Dr. Miri. Yes, it's very nice to meet you. Alright, so let's get started. I'm gonna first off ask you some information. For instance, what is your name and your birth date? Okay. Mm-hmm. And what is your height and weight? Okay. And have you ever had this exam done at a previous practice or anywhere else? Okay. Now, have you ever had any issues with nerve damage, loss of sensation, loss of movement? Okay, great. Nothing. And are you clear with what the examination is that we're doing today? All right, great. So the examination is a cranial nerve exam, and what I'll be doing basically is I'll be looking at the nerves that work with your eyes and your ears and your nose. I'll be looking at some of the movement nerves in your face, so some of the nerves that control your mouth, that control your facial expressions, that control your eyes, and just a lot of more kind of sensory nerves, really not so much movement. However, I want to make sure that I get every nerve studied and squared away just to make sure that all of them are in working order, which, you're healthy and they should be. So let's get started. All right. I hope you don't mind, but I'm going to wear gloves today. Just because it is flu season and we do have some sick patients, and I would prefer if I don't spread it around. All right, great. So first off, before we start, do you have any problems with smell, your taste, or your vision at all? All right, great. So let's go to the first test. So the first test is I want you to stare at my nose, and then I want you to point to which finger moves. All right, great. All right, great. Right now for the next test, I'm going to cover one of your eyes, and I want you to look at this pen. Tell me what color it is. Great. I want you to tell me where it comes in from. And then I'm going to hold it in, and I want you to tell me when you see it leave. All right, great. Now let's cover your other eye. And again, what color is this pen? Great. And I want you to tell me when you see it enter and leave your vision. All right, good job. All right, now for this next test, I'm going to use a light to look into your eyes. I would like you to try not to blink, and I'll keep your eyes open. All right? All right, now I want you to look far into the distance back there, and I'm going to do the exact same thing. I'm very sorry, it'll be over very soon, I promise. All right, good job. Now what I want you to do is I want you to keep your head very still. I want you to make sure you don't move it, and I want you to follow my finger. Just follow my finger with your eyes, all right? All right, great. Now I want you to keep your head again very, very still, and I want you to, all right, now I want you to keep your head very, very still, and I want you to move your eyes in the direction that I tell you. All right, so left, right, left, right, left, right, up, down, up, down, up, down. Good job. That's it. And now I want you to lift your eyebrows really, really high as they can go, and relax. And now I want you to tense your shoulders as high as they can go, and relax. And now I want you to screw up your face as much as it can go. Relax. All right, show me your teeth like this. Just show me, show me, show me. All right, great. Now move your mouth up to the top of your face. Now. All right, now move your mouth up as high as it can go, and now as low as it can go. Now smile as big as you can, and frown as big as you can. Now can you feel me touching the sides of your face? Does it feel normal? Do you notice anything different when I touch this part of your face? Great, good job. All right, and lastly, when I cover one of your ears, can you hear me when I do this? And now the other ear. All right, well, it sounds like everything seems normal, and your eyes look great, your ears look great, and it looks like the nerves in your face, both movement and sensory, are working just fine. So, I would like to see you again in a year if possible. If you have any other issues, if you have issues with any of your nerves, not just your cranial nerves, just give me a ring, just pop right in and let me know if you're having any issues. If you're feeling numbness, if you're like not able to move certain parts of your body like you should, just let me know and I'll be able to test them out and make sure that they're working just fine. All right, it was very nice to meet you, and I hope you have a good night. Bye.